Jeff. Good. Please go ahead.
Welcome. My name is Paul Brayshaw, and my wife Frances here. We'd like to welcome you to our backyard. We appreciate you all being here. We tried to clean up everything, so but just watch your step. You never know. There could be a fresh one out there, but so welcome. 36 years ago, I was born with severe factor IX deficiency, hemophilia. I lack a specific clotting factor in my blood to make it clot, and it's been a bit of a challenge over the years. In 2006, I reached a lifetime cap after 3 years. I was trying to figure out what to do, whether I should go on a disability policy, change jobs, or move states. Fortunately, my employer came through and was able to cover my health care costs, but it was a significant stress for me and my wife. We had an opportunity to have this employer take care of us, which made the world of difference. The problem with hemophilia, 90% of the costs are associated with the clotting factor, the medications I take. So it's been, that's really where I drive up health care, and it's important to have a policy that will cover that. You know, when there's capitation on plans and other things, it doesn't necessarily make my health better. It actually makes me worse and more expensive. So it's been something that I've had to work through. Fortunately, the Affordable Health Care Act is going to remove some of those burdens and remove the shackles. Really, I won't have to depend on the job for insurance anymore. So the Affordable Health Care Act is welcome, and I expect that it'll make a big difference in my life and that of other people who are affected. So with that, I'd like to thank you again for being here, and I'd like to introduce President Barack Obama. Thank you for being here, sir.
Thank you. Thank you, everybody. Thank you. Well, it is great to see you. Thanks all for taking the time to be here. I know it's a little warm under the sun, so if anybody at some point wants to shift their chairs into the shade, I'm fine with that. I won't be insulted. I want to just make a couple of acknowledgments of people who are here. First of all, I've got the Secretary of Health and Human Services, so she's charged with implementing the Affordable Care Act. Kathleen Sebelius, she's doing a great job. Former governor of Kansas, former insurance commissioner, knows all about this stuff. We're very proud to have her on the team. Somebody who helped to champion the kinds of reforms and patients' rights that we're going to talk about here today. Congressman Jim Moran is here. Thank you so much, Jim. And Falls Church Mayor Nader Baruch, I was just mentioning, Baruch means blessings in Hebrew, one who's blessed, and Barak means the same thing. So he and I were right there, and I know he feels blessed to be the mayor of this wonderful town. You know, when I came into office, obviously we were confronted with a historic crisis, the worst financial crisis since the Great Depression. We had lost 4 million jobs in the 6 months before I was sworn in, and we lost almost 800,000 the month I was sworn in. Obviously, the economy has been uppermost on our minds, and I had to take a series of steps very quickly to make sure that we prevented the country from going into a second Great Depression, that the financial markets were stabilized. We've succeeded in doing that, and now the economy is growing again, but it's not growing as fast as it needs to. And you still have millions of people who are unemployed out there. You still have hundreds of thousands of people who've lost their homes. There's a lot of anxiety and there's a lot of stress out there. And so much of our focus day to day is trying to figure out how do we just make sure that this recovery that we're slowly on starts accelerating in a way that helps folks all across the country. But when I ran for office, I ran not just in anticipation of a crisis. I ran because middle-class families all across the country were seeing their security eroded. Partly because between the years 2001 and 2009, wages actually went down for the average family by 5%. We had the slowest job growth of any time since World War II. The Wall Street Journal called it the lost decade. And part of the challenge for families was that even as their wages and incomes were flatlining, their costs of everything from college tuition to health care was skyrocketing. And so what we realized was we had to take some steps to start dealing with these underlying chronic problems that have confronted our economy for a very long time. And health care was one of those issues that we could no longer ignore. We couldn't ignore it because the cost of health care has been escalating faster than just about anything else. And I don't need to tell you all that. Even if you have health insurance, you've seen your co-payments, your premiums skyrocket. Even if you get health care from your employer, that employer's costs have skyrocketed, and they're starting to pass more and more of those costs on to their employees. More people don't get health care from their employers. And in addition, what you were seeing was that at the state level and at the federal level, the costs of health care, because people weren't getting it on the job and were trying to get it through the CHIP program or Medicaid or disability or what have you, all those costs were driving our government bankrupt. Anybody who's out there who's concerned about the deficit, the single biggest driver of our deficit is the ever-escalating cost of health care. So it was bankrupting families, companies, and our government. So we said we had to take this on. And most of all, as I traveled around the country, I'd hear stories from families in every single state. You know, they had a child who had a pre-existing condition and they couldn't get health insurance. Or they thought they had insurance, only to find out that in the fine print there was some sort of lifetime limit of the sort that Paul described. They bump up next against it, and suddenly they're out of luck and potentially going to lose their home or lose whatever savings they have because the insurance that they thought they were getting wasn't going to fully cover them.